I went by your house, what a big mistake. But for a while I thought that I wouldn't break. I need something else to clear my head, someone to tell me how to live instead. Just open your eyes and take my advice. Stop rolling the dice and just compromise. It's the chance of your life. Okay, try to be brave. You have so much to say. Take control of your own life. Right now, every mistake makes you feel like a fake. Take control of your own life. Without any thought, I keep moving on. I don't even care if my soul is gone. So many words that I should have said, not concerned about how to live instead. Just open your eyes and take my advice. Stop rolling the dice and just compromise. It's the chance of your life. Okay, try to be brave. You have so much to say. Take control of your own life. Right now, every mistake makes you feel like a fake. Take control of your own life. Nothing in life is good. Tired and misunderstood. I would fight if I could, if I believed I should. Okay, try to be brave. You have so much to say. Take control of your own life. Okay, try to be brave. You have so much to say. Take control of your own life. Right now, every mistake makes you feel like a fake. Take control of your own life.
Good morning, everybody. I have set up my camera. The lights were on. My bra was on. Is still on, actually. But, you know, I did all that. I had my camera on and I couldn't get it set up. It wasn't cooperating with me. So I'm here, but I'm not going to have my camera on today. It's good to see you guys coming in. This is an important topic I wish I had known 12 years ago. And just for anybody who's coming in who doesn't know me or know, I know the people who watch me know, but I had 3 back surgeries within like a couple years, and one was a 2-level fusion, and then the third one was because 2 screws broke. So you have to know that there's a lot of scar tissue in there, plus going under 3 times. And when I heard this guy, he's an anesthesiologist, and when I heard him, I was like, wow, I need to cover this. And it's been a while since I saw this, but we're going to look at that today and let him tell you, because that's what he does. So I'm going to share his video and we're going to react to that and talk about it. And after we're done, I'll put his link in the comment or in the, in the description. And everybody needs to go subscribe if you're interested in this kind of thing. And he's got the scoop. I'm sharing his scoop on my scoop channel. So that's what we're going to do today. How you doing, Amber? Good to see you. Heather Leanne. And yeah, Heather, gosh, yes, you need to listen to this guy. And beyond this video today, if you're about to have surgery. But again, if you didn't see my community post, I just saw on my Facebook memories that I had posted in there, my doctor said, you're the perfect specimen of health, or whatever he said. And I was around 50 at the time. So I'd never had any surgeries. I'd never had any major illnesses. I just was, really healthy, and had pain in my neck, and I still do. But this lower back thing was just a big deal. So, yeah, Betty Dan Boop, thank you. I look better without the camera on, so y'all are probably going, "Oh, thank you, Barb." But yeah, there's so much about surgery that we don't, as regular people, don't know, and some of it we probably don't want to know. And then I recently saw where some doctor got sued because they were making fun of a patient, and the patient had their phone and left their phone on record and recorded these doctors laughing at them. He was getting a colonoscopy, and he or she, I can't remember. And so these doctors were, laughing about, like, I don't know. It was just things that happen that we don't know about. Yeah, if it goes down your legs, Heather, you probably have sciatica like I do. And that sciatica pain goes down your both legs or one leg. I think it's typically on one leg, but it goes all the way down to your toes. And you can pinpoint which level of your back the pain is coming from because of where it hurts. And because one day recently I had pain in my big toe, which I had never had with the sciatica. And I looked it up, and it was from L4, L5, which is fused. So that bothers me. And then I just saw a Facebook post from a friend of mine. He's had lower back surgery too, and he's having extreme pain in his thoracic region, which is above the lumbar region. And they won't do an MRI because this is a new issue for him or something. And they told him if he would go to the ER, he could get the MRI on his thoracic spine and his lumbar spine. Yeah, degenerative disc disease. Some people call that arthritis, but yeah, I have it in my whole back. Most people have some degeneration in their backs, and also lower back is, I don't remember the percentage, but it's like 60% of adults or something. If y'all hear a little bit of noise, I had put Rosie in her crate where it's her bed, and she goes in there when she wants to, and I don't normally shut the door. But since she likes to pee during my live streams, we're going to do that today. And she's not real thrilled about it. But Rosie, it's okay, baby. I'm right here. It is literally debilitating. So he's going to go into some of what happens when you have surgery, the anesthesia, and how that affects us. We'll go ahead and get started with that. And, oh, they changed that little button. Okay, I'm about to start it. I'm about to start it, and let me know if you can't hear, because he's going to be talking.
Surgery more than twice in the last year. I'm often asked before they go in the operating room, often the night before when I'm calling them on the phone, they'll ask, "Hey, doctor, will I be okay if I get surgery again or anesthesia again?" And it's a very valid concern, because what happens to the body, the mind, the brain from repeated exposures to anesthesia and surgery? The surgical stress. So I'm going to share with you 3 main things that happen from surgery on our body, our mental health, and specifically the anesthesia risks, the memory loss being a big question, as our anxiety, depression, PTSD, etc. And I'm also going to share, importantly, some ways that we believe those risks can be reduced or mitigated. So I appreciate you all for answering that in the poll, this topic that we'll talk about. I'm sure many of you can share this with your loved ones who are having surgery or friends, and you can probably see Karma the dog in the background. She's going to be a part of this because of the role that pets and pet therapy can play to help potentially reduce some of these risks.
Oh, well, my pets basically saved my life. Just saying. You got to love anybody who's got their dog on camera. So this guy, I love this guy. I don't, I don't know his name. I mean, I don't know him, but I like him.
So number one is the risks of having repeated surgery. If any one of you has ever had surgery before, you'll know that, or you'll probably know that there is always a risk of what's called adhesions. Surgical adhesions, referring to the scar tissue that forms after any incision in the body or any cut or damaged tissue in the body. Unfortunately, anytime we have surgery, there's a risk of this scar tissue causing complications at any point in the future. A common example is what we see in any abdominal surgery, whether you've had bowel surgery, gynecological surgery, etc. All of those areas where the knife went through the first time can cause thick scar tissue, which might cause complications with other body organs in the future. A common example being what's called strangulated bowel tissue. Strangulated literally is like bowel that's getting strangulated, which can cause obstructions. We call these small bowel obstructions sometimes. If that scar tissue prevents poop, if you will, from going through the rest of your intestines. So
he said poop, y'all. Did you hear that?
anytime you have surgery, and the more surgeries you have, the more scar tissue you have, that scar tissue can always present complications with adhesions that can cause obstructions or even pain if tissue is getting stuck against those obstructions or nerves are getting stuck against those obstructions. There is always the complication of blood clots. The more surgeries we have, especially in a short period of time, this is a separate issue, by the way, the more sedentary we are if we have multiple surgeries, because often, as you know, you can't go and run a marathon after surgery. So if you have multiple surgeries in a short period of time, it means that you're probably not as mobile or active as you ordinarily would be. That increases the risks of blood clots, which can then go to your lungs and cause emboli, what we call pulmonary embolism. That risk will increase. Weight gain is a big one that comes up because the more surgery that we have, the more risks of being, as we said earlier, sedentary.
The sedentary part, that's going to happen after pretty much any surgery, and it changes your life, and most of us don't realize all of these things, and I didn't, and I had all of these things. The depression and stuff just about nearly took me out.
Not being able to do the activities of daily living that we often do either for pleasure, which can lead to mental health complications, which can lead to weight gain, or just not being physically active will increase the risk of weight gain, obviously. And yes, this is Karma here. We'll get to her in a little bit, I promise. Weight gain is a serious one, especially when it comes after hip or knee replacement surgery, because oftentimes we do these surgeries to help patients become more active. But what's not said is that sometimes without the right mindset, that surgery will actually lead to weight gain and potentially less physical activity. Now, I'll underline so many of the benefits that the surgery is hoping to gain. And Alexis, good to see you on there. Chronic pain is a big one as well. And this is highlighted by the type of surgeries, because all of these surgical complications, of course, increase the more surgeries we have within a short period of time, but also depending on the type of surgery. I already mentioned, for example, that adhesions in the abdomen are going to be more common after gynecologic surgeries or any other abdominal surgeries, pelvic surgeries, etc. But in cases of spine surgery, we know there's this failed back surgery syndrome.
Hey, Angela. Yeah, they said I had failed back surgery, whatever you said.
The failed back surgery syndrome is going to be more common the more attempts at correcting back pain that you have. So the more interventions, the more adhesions, the more risk of entrapping nerves, the more potential for chronic pain, especially if it's in the same area of the body. Complex regional pain syndrome, similarly, you increase the risks of this occurring after surgery, the more number of surgeries you have. And for cardiac surgery, for example, we know that so many risks to, for example, memory come from clots that go to the brain. And those clots are more common to happen when you are on the cardiopulmonary bypass machine. So specifically for cardiac surgery, the more cardiac surgeries you have, the greater the risks of brain complications. So the point is that the surgical risks depend on the type of surgery, where it is in your body. And it depends also on the medical risks you bring in. For example, when you have poor...
Has anyone in here had major surgery? And has anyone in here had, just if you have had surgery, how many times? And like in the same, like mine were all three within the same incision area. Yeah, I don't remember stuff either, but I've never blamed it on surgery, but now I'm going to, right?
Blood glucose control, if you're a diabetic, you are more likely to have infection risks with every surgery, because we know that unregulated blood glucose levels or blood sugar levels increases the risk of surgical site infections. For example, any other number, and we'll talk about this in the next couple sections, the medical health that you bring to the surgery will determine what risks are more likely to compound with more surgeries. Now, what can you do to minimize these risks? Well, I mentioned one already, and that's maintaining a solid blood glucose level. So the better controlled your glucose is, the less the chance of many complications, including infections. Of course, optimizing your body weight, having a healthy body weight before surgery, is also going to minimize many risks, including blood clots, including chronic pain, etc.
Hey,
Your
Salma.
nutrition is important. The less optimized your nutrition is, the less quickly your body can heal from the surgical wounds. The longer it takes to heal from your wounds, especially if you've had multiple surgeries back, the longer it takes to heal, the more pain you're going to have because your body is taking longer to heal. And then lastly, the concept of prehabilitation, which includes nutrition and includes physical activity, refers to the greater our cardiovascular fitness, it appears the less the chance of having surgical complications in the body. However, of the ways that you can optimize your body the best before surgery, your mental health optimization has the most evidence for and the greatest bang for your buck. And that's the next section. Number 2, mental health effects from multiple surgeries. Before we go on to that, I do see some wonderful comments here. I want to...
They do, Betty Dambu. And then also, like, there's a lot that happened, like, to me after surgery, was being unable to work, too much pain, which in essence, which then causes financial difficulties. And if you already have a problem with depression, then all those things pile up on your depression and anxiety. There's a lot that like went into that was my worst major depressive period of time after these 3 surgeries. And it was all exacerbated by all those things, but I didn't realize that also actually the surgery itself had done a lot of that too. So, I mean, I had a lot coming at me, and I'm just sharing because that's all I can share with you is I don't have a doctor's knowledge, but this stuff happened to me. And I would hope that, the ones of you who are listening or watching this can take this knowledge into your future. I don't know if y'all can hear Rosie. She's throwing a fit. You can take this into your future I'll take it into mine for the next surgery. Hopefully I don't ever have another one, but it's kind of likely that we as adults would end up having surgery. I'd never had anything again before I was 50. So, and then I had 3 within 2 years, and here I am suffering from that now. So let's continue with what he has to say.
Give shout outs to everyone who's leaving these insightful comments. Cindy, Matt, Maggie, Nadia, Sophia, Alexis that I mentioned, Steph. Thank you all for sharing with others your experiences to help empower others. As always, you know that I don't like to do any ad placements or product placements. So if you do hit that like button or share what you've learned with others, you'll help share this powerful message and you'll help support me doing this more often for you. I do see a comment about protein. Julie, there is a very important role for optimizing protein. I talked about it in other videos, because you do need to have the building blocks to heal tissues after surgery. Of course, we don't ever talk about the quality of the protein. It's something we can talk about in future videos, but there are various weight-based doses. You always want to.
And that was something nobody shared with me, that I needed to eat, like he's saying, like I didn't know. And I was active before. I was going to the gym about 5 days a week for 5 years, and taking my dog for 3 and 4 mile walks before that surgery. So I was pretty fit. I wasn't, totally fit, but Rosie's throwing a fit if you just came in, because I locked her in her crate.
Speak with your doctor before to make sure that your body can tolerate those higher protein loads. And Alexis, thank you for that kind super thanks for treats for Karma. She very much appreciates it. We'll get to Karma very soon, because we're going to talk about the mental health effects. And that refers to the dark side of surgery, because we talk about surgery all the time as healing the body, but breaking the mind, or fixing the body and hurting the mind. Because what no one talks about, in my experience, about complications, especially from repeated surgeries in short periods of time, are the risks of depression, post-operative depression, anxiety, and perioperative, meaning around the time of surgery, panic attacks, or PTSD, perhaps from anesthesia recall. And Patty, thank you as well for that super thanks for treats for Karma and Mochi. Mochi is actually off to the side on her cat bed right now, but Karma is right next to me. I'm sure the cat will come by as well at some point to say hi. Regarding the mental health effects, what also people never talk about is the isolation and loneliness that can be caused by surgery. When you're not out there with your family and friends because you're at home recovering, when you may not have someone to help cook for you because maybe your hands are in casts and you can't cook for yourself. You can't go and see your neighbors, etc. And this plays a huge role in worse outcomes, because your mental health state after surgery will influence the risk of acute pain turning into chronic pain after surgery.
What did he just say? It's all my fault. I got this back surgery pain. Well, yeah, I couldn't cook. Salmonella. I couldn't cook. I couldn't. I had, the first week I couldn't take a shower. Like I had somebody come into my home, a friend, when I needed to take a shower, or and change my dressings on my back. Because I couldn't do that myself. But yeah, having support if you're going to have surgery, have a bunch of meals cooked up ahead. If you don't have anybody to cook for you, have things so that you don't have to worry about that. Now, if you're in a lot of pain and you're about to have surgery, you don't feel like doing all that. Maybe you can go somewhere and get those they do meal preps for you. Have that. I did have a few people who brought dinner by to me. That helped a lot, but it would be ideal to have that all ready before, because I live alone, and I lived alone then, and I had 4 dogs at the time, and they were lifesavers to me, mentally, but still.
More anxiety after surgery may contribute to kinesiophobia, which can lead to more blood clots, like we talked about earlier, greater weight gain, surgical complications in the form of frozen joints. What is kinesiophobia, you ask? Kinesia refers to movement. Phobia refers to fear of. Kinesiophobia, therefore, refers to the fear of movement. For example, a common example is after knee replacement surgery. For any number of reasons, the patient might not fully partake in their physical therapy. I'm not blaming the patient, but it's a reality that happens time and time again. What happens when patients don't participate in their physical therapy fully or as much as they can or should? They have to come in for another round of anesthesia because we need to do a manipulation under anesthesia. What happens? Scar tissue that I mentioned from the first section can make a joint so rigid that they can no longer move their joint. Cindy.
So from scar tissue, right? So, and like what they did for my back, you go through a lot of muscles in there in your back, and they cut nerves and muscle, and all that stuff has to heal. And I've got a divot in my back. Like, I guess when they stitch up your back, they don't care if, I don't know. I have a weird, if you feel my spine, it feels weird. There's a divot, and then it kind of protrudes a little bit, and then there's another divot. It's kind of weird. Has anybody had knee surgery? Because this sounds pretty nasty what he's about to talk about.
Dotson, by the way, thank you for that kind super thanks as well. It's very much appreciated. When we have a tremendous amount of scar tissue around a joint and it cannot move, we call it a frozen joint. It happens really in any joint, but in particular, shoulders and knees after major surgeries, if they're not bending the joint around enough to help prevent that scar tissue from sinking in place. Well, you cannot break that scar tissue without another round of anesthesia because it hurts a tremendous amount. So oftentimes patients come to the operating room with me after having a successful knee replacement, but now there is so much scar tissue that we have to put them to sleep again while the surgeon cracks the knee. It is probably one of the most disgusting things I have ever heard in my life. Breaking apart all the scar tissue releases a tremendous amount of blood, by the way, so they have a lot of swelling afterwards. But that's the only thing that can be done to help remobilize the joint. So preoperative anxiety can lead to post-operative anxiety worsening and kinesiophobia. That's the link with these other surgical complications from the mental health state. PTSD is a different beast altogether, and that can happen when we might have some element of awareness under anesthesia in the operating room or in the intensive care unit. And needless to say, that PTSD, which we sometimes call medical PTSD, can be tremendously debilitating and might prevent patients from seeking medical care in the future. Do you know anyone who has had medical PTSD? I hope you don't, but I can certainly tell you that many of you on this channel have shared your personal stories of yourself or loved ones, and it is incredibly powerful. Damn it, Janet, thank you for that super thanks. And you ask, what causes psychosis after surgery? Actually, exactly what I was going to get to right now. So you are right on point, Janet. The risks for
Hey, Bones. How you doing today? How you doing?
Post-operative delirium, which will, of course, compound, we believe, with the more surgeries you have in a brief period of time, are similar to the risks of post-operative cognitive disorders. And this also affects our mental health because the worse our depression before surgery, the more likely we are to be experiencing poor cognition before surgery. And the worse our cognition before surgery, the greater the risk of delirium after surgery and persistent neurocognitive deficits after surgery. So the causes of the psychosis, like Janet asks, we don't really know all of them, but we do know that pain, low oxygen levels, high carbon dioxide levels, poor cognition at baseline, not having a high level of educational attainment, having a poor social support system, and other risk factors that you can probably imagine quite intuitively can contribute to somebody having emergence delirium or ICU delirium. Other big factors include poor sleep regulation before surgery and after surgery. So not being on a circadian sleep cycle, which is not necessarily their fault, because if you're getting stabbed for blood draws every 4 hours, including overnight, you can only imagine the quality of sleep that you're going.
Hey, Jen. I had hallucinations. I thought, and it could have been what he's saying after my surgery, one of the surgeries, but I was talking to people who weren't there. Like I was just talking to people in the room. I mean, I do that. I talk to myself, but in that instance, I was talking to an imaginary person, or maybe there was a ghost. I don't know. You've had 8 surgeries, Salma? Goodness gracious. I'm so sorry.
Going to have? What if the healthcare staff, maybe they're nurses, maybe they're doctors, maybe they're cleaning crew, are joking around on the late night shift and you can't sleep, or your neighbor's TV is on and you can't sleep? These are all things that have a huge role in developing post-operative delirium or psychosis, like Janet said. Your preoperative depression, anxiety, etc., will also presumably add a risk to psychosis and post-operative cognitive deficits after surgery, because there is a correlation between more medication taken for mental health conditions. The more those medications, for example, the more Zoloft, the more Prozac, the more modafinil, the more et cetera, SSRIs, SNRIs, stimulants, etc., the greater the risk of having complications related to your mind after anesthesia. Very, very real risks, and ones that we can address by having a solid social support system.
And it's important to tell your doctor what medications. I don't think it's in this video, but on one video, he talks about the effects of that. The anesthesia has different effects on people who have used marijuana, and I was an active user, and I don't remember telling anybody, because that's something that you just don't normally tell everybody. It's legal here now for medical, so I would be able to say it openly because I do have my card. But at that time I didn't, so I don't recall saying anything. But it's important, if you do anything that you use, it affects the anesthesia and how it works on your body. So if you do any of that, tell your doctor.
Before surgery, to minimize the risks of loneliness and isolation, which will only get worse after surgery if they're not addressed before. And before I give the rest of those general guidelines for risk reduction, I need to address this super thanks from a Cougars Cub. A Cougars Cub. I like your username. Thank you for that super thanks. I had anesthesia having my wisdom teeth removed, says a Cougars Cub.
Hey, Mark.
I remember they gave me 2 doses of the white stuff. I could still hear everything the doctors and nurses were saying. I was aware but didn't feel. How common is this? This is anesthesia awareness or anesthesia recall. It occurs in about 1 in 1,000 or so individuals. More common in cases like this that are sedation, like wisdom teeth. Wisdom teeth are rarely removed under general anesthesia. It's typically with sedation given in the IV. It is quite common. I'm happy to hear, not painful. However, it can lead to traumatic experiences that, without the right external and internal support, can lead to an acute stress disorder or post-traumatic stress disorder. I hope that you had the right support there, Cougars Cub, and that you had not experienced symptoms of PTSD from that experience. Thank you for sharing that, but you're certainly not alone. And for certain cases of sedation, it's common and it's sometimes expected. The most important thing is that the patient is not in pain during the procedure, because that will certainly increase the risk of bad outcomes if you are aware and in pain versus being aware but not in pain. We've talked about this in many other videos. So thank you for sharing that. And I encourage you to look at those other videos where we talk about anesthesia awareness and PTSD risks. So I was saying the other ways to reduce the risks of mental health complications, having that strong support system is so powerful.
A lot of people don't have that support system. I didn't, and don't. And that was one of my fears going into surgery, was like, how am I going to take care of myself and my dogs after I get, but I didn't have a choice. And I did have help a little bit. Like, I had someone come in and take care of my dogs while I was gone to the hospital, but I didn't have very much help. And that's on me for not ensuring that I did.
Because of the huge risks of isolation and loneliness. And this is where karma comes in, right, baby? Pet therapy is incredibly powerful, especially in the pediatric population. Did you know that having a puppy to pet after surgery in children has the same equivalence in pain reduction as low doses of morphine. The great difference being that there are no side effects like morphine that we have for pets. One of the most common intolerances that patients tell me about are to morphine, whether it's flushing, nausea, constipation, creepy crawly sensations under the skin, feeling sick to the stomach, etc., etc. Kyle, thank you for that super thanks. I appreciate that, by the way.
Okay, wait a minute, Salma. You were awake and you could hear what they said? Oh no. I've never I do remember one of the surgeries. I do remember being in the operating room. I don't know why one I did and the other two I don't, but I remember being in there. And then I remember my doctor was on the phone and I was talking about a 3-wheeler, 4-wheeler, whatever, and I was mad because he was late to the surgery because he dropped his kids wanted him to take them to school that day. And I'm like, I was scared. I didn't have anybody with me pre-op for the I guess that was my 3rd surgery. I didn't have anybody with me and I was scared, it was a big surgery. Somebody dropped me at the hospital and then I, was in pre-op alone and that's okay. But I mean, I was nervous. But what do you remember? Oh no. Yeah, Salma, I just can't even.
So pet therapy before and after not only helps for pain, which
No
is
pain,
heavily
Salma.
influenced by our mental health state, but also influences perhaps our memory. So we're going to talk about memory next. That's number 3, the effects of anesthesia in repeated bouts for surgery in relatively short periods of time. Now, before we get to the memory, I'll quickly say that tolerance to anesthesia clearly increases because we know that the more exposures you have to any anesthesia, the more your body responds by changing the number of receptors, what we call receptor density, throughout your brain and spinal cord and the rest of your body, but we mostly focus on the brain and spinal cord. So, for example, if 1 milligram of midazolam knocked you out before surgery, if you've had 3 surgeries, you might need 2 milligrams of midazolam to achieve the same effect. The same goes for opioids. If you needed 50 micrograms of fentanyl for 1 surgery to go through a particularly painful part, you might need 100 micrograms if you have a similar experience, if you've had multiple surgeries, because your body.
And some of those medications he's talking about, I had not during surgery, but during outpatient procedures where they don't put you under general anesthesia, but they do pretty much knock you out. Like you have to have a driver and all these things. And they gave me these different things he just mentioned, like, you don't remember. And also they keep you from remembering anything so that even if there is pain during that time, you don't remember it. But, your doctors need to be aware of all those things that you've had too, because you've had those medications, or if you've used illicit drugs, if you've used any of these things out of the prescription of a doctor or under, I mean, either way, but he had to tell her. The doc talked about his new red sports car. Oh, this patient's giving me enough money to buy my new sports car. Wow, Salma.
Builds tolerance. The same goes for so many other medications, whether they're blood pressure medications, proton pump inhibitors, some medications for depression and anxiety, certainly pain medications, sleep aids, recreational drugs, alcohol, etc. We all know that we will build tolerance the more exposure you have to a substance. Not controversial at all. However, let's go to the memory part. What contributes most to people losing their marbles after surgery and potentially never getting them back? And can pets potentially help with that? Well, let me tell you first off that time and time again, when we give pets to patients, there is a repeated response in patients, and that is that they have a sense of responsibility. It's very difficult to give people a sense of responsibility with a pill. If anything, you might take away a sense of responsibility. As we've talked about in so many other videos, sometimes medications disempower us from taking responsibility for our health, taking away our agency, etc. When you give a pet to somebody, whether it's a dog, whether it's even a box of crickets, when we give boxes of crickets to patients in nursing facilities, we find that they develop a sense of responsibility to take care of the crickets.
See, and I have a worm farm. Does that make any sense? That all that anesthesia made me weird. That's what made me weird. Yes, I lost my marbles too, Bones, and I'm just now finding out why. Gosh, all the things this stuff puts us through.
And something about this sense of responsibility appears to increase their cognitive function, or at least minimize the risk of it declining the way one would expect in elderly people in nursing homes. This is without medications, guys. This is giving a box of crickets. I wish we had more studies.
I mean, a box of crickets? A box of crickets. Really? So these worms that I'm growing or breeding are helping me with my mental health? Wow. I thought it was just the dogs.
On this, but quite frankly, I don't know how many more we need either, because the risks of taking care of a pet, even if especially a small pet, are so little compared to the risks of medications, especially in the population that's most subject to having memory problems after surgery. And that's going to be your grandma and grandpa, the elderly.
Mark, was that the one you put in your beer?
I like to say over age 65. It can certainly be anyone, but it appears to be in the elderly more. Now, what else contributes to persistent memory problems after surgery? Well, if you're frail before surgery, no question, that will increase the risk, because as we age, we have less physiological reserve. What does that mean? This is a really important concept for anyone who's interested in aging or reversing aging or longevity medicine, etc. As we age, our reserve plummets for every organ system. Your kidneys cannot tolerate insults as well the older you get.
Mine does too, Bones. I've kind of always attributed that to medical marijuana, but yeah, it loves beer, Mark. Yeah, feed the pet rock the beer. But yeah, I mean, my memory's really bad. Oh, it's so bad. Yeah, I don't even want to go into that, but
your brain cannot tolerate insults. Your heart cannot tolerate insults. Your lungs, your liver, etc., etc. By insults, I mean things like, gee, maybe having impaired blood flow. Impaired blood flow can be like a clot in your brain leading to a stroke, a clot in your heart leading to a heart attack, a clot going to your kidneys, or, excuse me, I have to sneeze. Karma got scared. Hey, when you're live and unscripted, you do have to sneeze sometimes, right? So when you don't get enough blood flow to your kidneys, when you're older, they can't tolerate that insult. Less blood flow leads to tissue dying. Not controversial at all. So the older you get, the less your organs can withstand. Hey, thank you for everyone who said bless you, by the way.
so I mean, if you're aging, which everybody's aging, right? There's nobody who's if you stop aging, then you're yeah, Mark. If you stop aging, you're no longer alive. So, everybody's aging, but all these things come with that. So that's important to remember. even for those of us who can't remember, you can come back and watch this video.
I appreciate it. The less reserve you have, the greater the risk of bad things happening, like cognitive impairment. So older individuals have less reserve in their brain for things like low blood flow from low blood pressure that might be encountered during surgery, which is why we need to be very careful for blood pressure management in the elderly. If you've had a history of strokes, you have less reserve in your brain because your brain has already been insulted before by that stroke. We have to be extra careful in those patients to make sure they have the right blood glucose levels and the right blood pressure. We need to make sure that substance use disorder is addressed, because the more alcohol you use before surgery, the more weed you use, the more other drugs you use, the greater the risk of memory problems after surgery, because your brain has already been subjected to these substances in excess. It has already taken a toll on your cognitive health. And then there's the concern for the type of surgery. So when you have major orthopedic surgery, you have risks of blood clots, risks of blood loss, low blood pressure. These can all contribute to.
After I had my, I think it was the first. Well, I think it was the major when I had the 2-level fusion, which was the middle surgery, and my blood pressure kept dropping, and they gave me blood, and the blood made me itch like crazy. And then, like, I'm not sure why they were, I know why they gave me blood, but my doctor wasn't too happy with that. Listening to 3 to 6 songs per day helps memory. What did you say?
Memory problems because of strokes from either low blood pressure or from blood clots. Cardiac surgery, we've talked about before. Open heart surgery, you have to be connected to a cardiopulmonary bypass machine that can send clots to your brain. Emergency surgeries appear to also have an increased risk of memory problems after surgery, as do long surgeries, because the longer the surgery, the more the risk of something bad happening to your brain. And of course, the more surgeries you have, especially in a short period of time, you just simply are adding these risk factors. So this is a major one that we can mitigate by reducing frailty as much as possible before surgery. Once again, prehabilitation, the right nutrition. I talked about various supplements in other videos. I don't recommend any particular brand at this time, but the general concept of having appropriate nutrition is important. Having the right physical activity, cardiovascular fitness, VO2 max, etc., and the right mental health in terms of anxiety, depression, etc. This does affect our frailty and our cognitive reserve and makes an impact after surgery. The greater our social support is tremendously important, because you know what helps reduce the risk of delirium after surgery? Do you have your sleeping aids? I mean, your hearing aids? Do you have your eyeglasses? Do you have someone to help feed you? Do you have someone who's caring for you? These aren't medications. These are basic humanity-based like connections with people in the world around you. These aren't medications that help reduce the risks of cognitive problems. These are just basic common sense, being human being and not human doing. Matt Mittens, thank you for that super thanks. Matt says, anhedonia. I have post-surgery 2019. I guess you had surgery 2019. I have security clearance, mental health evaluation is off limits. I can't enjoy skydiving or aerobatics. Matt, I'm not too sure what you're referring to there, but anhedonia after surgery can absolutely happen if our depression is either increased from preoperative levels, or if we have new post-operative depression, which can absolutely happen for all the reasons I shared. Matt, I'm sorry that you've had that. I hope you have had.
And I mean, this just makes so much sense to me, having suffered from so much depression after my surgeries, not having the social support, just the things that surgery causes, the medications and everything. It's just, it's amazing, all these things. And I hope that some of you guys will remember this, if you got any memory left, before you have your next surgery, and just ask the questions and talk to the doctors and tell them what you're looking at, so that they know how better to treat you. Now, in today's medical situations, I'm not so sure that that happens because it appears that the medical community doesn't care. I don't think it's the people as much as it is like the insurance companies and all that and the way things operate. But we have to take care of these things ourselves a lot of times, and knowing, education and knowledge is worth everything. So just keep these things in mind for your future. I mean, I know now, so now I will use this if I have to have another surgery.
Had success in finding a trusted mental health professional to help you heal from that.
Right.
Thank you for your vulnerability and sharing. Darcy, thank you for your super thanks. You mentioned ANR, anesthesia-assisted rapid detoxification.
Yeah, Mark, when I got done with that big surgery, the second one, I mean, I was barely out of, I mean, it was like a week or two later, and I'm getting a bill for a lot of money, and I have really good insurance. So, it's very distressing when you get this bill and you're worried about everything and you get this huge bill and it's like due now, and that's a huge stress, huge stress. The surgeon's not going to do that, but you can talk to your primary care physician, or if you have depression or any of these other medications, he's talking about medications, those things you've got to make sure you tell them. You got to make sure you tell the surgeon, the anesthesiologist, you have to make sure that you tell them everything, and that will help your care. But you need that backup system when you get through with surgery. And even now, like, the surgeons don't see you in the hospital as much. They barely do. And you have a hospitalist. At least that's what happens here in my state. And the hospitalist becomes your doctor while you're in the hospital. But then when you leave, they're not your doctor anymore. So you have all these different doctors, and if they could all coordinate, that would be great. But that's where it's left up to you. And if you have someone with you, that helps because they can talk to the doctor too, like if you're having problems after surgery.
Been on methadone for 20 years for chronic pain from a Chiari malformation. First off, Darcy, I'm sorry to hear about your Chiari malformation, but anesthesia-assisted rapid detox is not something that is condoned by any major medical society, has significant risks, especially when performed under the supervision of, pardon me for saying this, marginal providers. So I do not know of any that I can recommend or that I can have any evidence to support at this time. If you have any other evidence, so please do let me know, Darcy, but I would certainly be very, very, very concerned about ever approaching any of them. So to recap the risks for anesthesia-related complications, we have to recognize that the more your brain is hurting before surgery, the worse it might get after. That's where pets, Karma right now isn't in the view of the camera, but she's here giving me puppy eyes, wanting more treats. But pets can help us with responsibility and purpose and fulfillment. The more of which we have before surgery, the greater our surgical recovery. That's when the majority of these side effects from the anesthesia may come. I wish I could say that anesthesia itself can be changed to reduce the risk, but that's simply not the case. A small exception being how deep someone is under anesthesia. The deeper someone is, it appears that that might increase the risk of memory problems, but we really don't know for sure. But that's again why I recommend patients to be clean off of drugs, because the more drugs you use before surgery, the more anesthesia you're going to need, especially weed. Of course, the more anesthetics you get back to back, you're going to have more tolerance and you're going to increase your risks, but you might not be able to change that if you need surgery. but you can hopefully affect substance use. I'm not saying marijuana is bad, guys. You know that I have many videos on cannabis and it can have many powerful properties, but it has to be used responsibly and ethically, which is unfortunately not what I see in many of my patients, at least here in the San Francisco Bay Area. Now, lastly, and Karma's just giving me these puppy eyes for more treats. I wish you could see them as well. But you don't need to have pets. You don't need to drastically change your lifestyle if you want to avoid these risks. But you do need to have a sense of connection with yourself, with your health. Because if you can prevent your surgeries in the first place, that's always the best. Heck, I make my living off of people having surgery. So I'm not saying surgery is bad. Sometimes it can be life-saving. But an ounce of prevention is a pound of treatment. So if we can prevent the need for surgery, that's always the best. When we are in touch with ourselves and we have meaning and purpose, we are more able to take responsibility for our health and to be able to try to pursue preventive measures. We can't always be successful, but at least we can try. The more isolated and lonely we are, the less meaning and purpose we have in life, and the less we can be preventive. So please engage in all of your social networks with friends and families and neighbors. Say hi to someone you haven't met before, a neighbor, someone walking down the street. Your smile might make you feel better because we know of that feedback loop in our brain for oxytocin and dopamine to an extent, and serotonin to an extent, and what the other person's going to feel. You might just make their day and help them get this much closer to having responsibility for their health, to help prevent them from maybe needing surgery at some point in the future. And all the side effects we talked about when surgery gets stacked up back to back in relatively short periods of time. So please remember that you have more power over your health than you've ever been told. Surgery isn't bad, but if you can prevent it, which you might be able to for many surgeries, certainly not all, it helps you be in control of your health and help those around you. As always, if you appreciate.
Okay. Again, I'm going to put his link in the chat. In the description. I'll put a link to this video.
Coming on these live streams, do please hit that.
And then go subscribe to his channel if you're interested in this kind of thing, because as we age, I just find where have I ever heard any of this before? Nowhere, only from him. I'm not saying he's the only one who talks about it, but that's my first experience with it was from him. And so I'm subscribed. See right there. Oh, you can't see it anymore. But yeah, so if you can prevent it, that's a great thing. If you can't, then you have to just be open and honest about everything and have your support. If you can find a support system before your surgery. Obviously, if you don't have a support system and then you have emergency kind of surgery, you don't have any way to build that up. And maybe that's not even possible because some of us are not as good as others as making friends and asking for help. I appreciate everybody who's here today, and I'll see you all soon. I believe our next live stream will be Ask Barb. The questions are coming in, and they are fabulous questions. If you have a question, it's like a, Dear Abby column. Yeah, you're going to call me. It's a Ask Barb column, and some of it's for humor and everything. And so if you have a question that you want me to answer, please make them fun and humorous if possible, and send it to thescoopwithbarb@gmail.com, or, I don't know, put it somewhere, give it to me somehow, put it in the mail. I don't know. I enjoyed having y'all today, and I will see y'all soon. Bye.